issues just then, so we'll start the webinar again. As I said, I'm Kate Thornton, the Senior Digital Marketing Manager here at MorePay. Today we're going to be talking about the topic of living with COVID and what the new normal looks like. Before we begin, I'd like to make a note of a few things. There are over 900 people registered on the webinar today, so you are in listen-only mode, but I'd like to encourage people to put any questions into the chat box or the questions box during the webinar, and Audrey and Phil will endeavour to answer them at the end of the session today. As I say, we're keen to get to as many questions as we can at the end of the session. How to do that, I've just got on screen now a very quick box of how to ask a question. As I say, feel free to pop them in and we'll answer them as many as we can at the end of the session today. So first, I'd just like to touch on the agenda. We're going to be summarising living with COVID and the new plan, HSE and public health guidance, and absence management, and then we'll have a Q&A at the end. So I'd just like to introduce a little bit of who MorePay is for those who don't know, just very quickly for those attending this morning. MorePay, we're the payroll and HR software experts. We've been around for 50 years, and you can see some of the logos of some of our wonderful customers there. We promise to make payroll and HR easy, and there's lots of ways that we do this. But one really important factor is our software, and in fact, we've just launched our next generation payroll and HR software, which we think is a bit of a game changer in the market. It's easy to use, it's easy to access, and it's easy to trust. It's packed with automation, integration options, helpful analytics, and a mobile app for users and employees. But most importantly, all of this means it's worry-free compliance for your business. If you'd like to know any more about our software, please drop a message in the chat and I can provide more info throughout the webinar. Now, I'd like to move on quickly with regards to our presenters and our amazing people who have given their time today to talk. Firstly, I'd like to introduce Audrey. Audrey Robertson is our HR consultancy manager. She's been with us since around 2017, and she manages all of the employment law and policy and consultancy teams here. She's got over 15 years experience in employment law, and so Audrey, thank you for joining us this morning. I'd also like to introduce Phil Barker. Phil Barker is our resident health and safety expert with over 20 years experience in the business. He's worked for MorePay for about 2008 now. But yeah, he's a really great guy, and I can't wait to hear what his stance is on living with the new COVID throughout the session this morning. So without further ado, I'd like to hand over to Audrey to talk about, is the pandemic really over?
Good morning, Kate, and thanks for that. And yes, good question. And the short answer really, I think, is no. Last week, the Office of National Statistics estimated that 1 in 25 people just in England had COVID. That's over 2 million people, and that's up from 1 in 30 just the week before. Obviously, although this is a really high number, we're in a very different situation from the early days of the pandemic. As you can see here, hospital admissions are up. They're higher than they were in January, but obviously far, far lower than they were before the vaccination programme. Deaths remain low. And there's also some evidence the rise in infection is particularly strong in older age groups, which does mean it affects the workforce less at this point. So what are the implications really for employers? Firstly, one reason for the rise in infections amongst much older adults is thought to be probably related to how long ago it was that they were vaccinated and then boosted. It's 6 months now since booster programme began. So it is possible that this kind of increase will move down the age range into younger age groups. And of course, it's happening at the same time that all the main restrictions have been lifted, and we're all getting out and about, socialising more, more return to work and so on. And there's also high numbers of infections in school children. And of course, schools remain open, but children testing positive aren't allowed to go to school. And this impacts on workers who have caring responsibilities, have to be off. So it's really important that you think now about a continuing scenario that's going to go on into the summer of people off sick. There are predictions for the types of waves of sickness we might see next winter as well. Look at the way you've done things through the pandemic and think about how you might deal with it going forward, really. So, Kate, if you'd like to move us on to slide 10. So, for employers living with COVID, What are the main points? So firstly, we're going to go into a lot more detail on this in a moment. Phil's going to take us through that. There's effectively an end to all legal restrictions. So the legislation that enabled all these restrictions to be imposed has been repealed. There are now effectively no special legal rules about COVID at all, or about its spread. What we do have still is government guidance, and that links into where most of the bodies, such as the HSE, are looking for what to recommend. The main effect is that employers, the emphasis is now on employers to manage the risk themselves and for people to take personal responsibility. So when we're talking about making rules in the workplace, it's a little more difficult than it was when there was some clear law in place. We talk so far mainly about what's happening in England, but in a few weeks, the whole of the UK will be in this situation. So Northern Ireland, in fact, never had a law about self-isolation, just strong guidance, and they've already lifted restrictions. Scotland are planning to lift theirs on the 21st of March, and Wales is talking about the end of March if the situation allows for it then. So as we move forward, we're all going to be, as they say, in this together. So I'm going to put you over to Phil now to let us know about what this means in a bit more detail.
Thank you, Audrey. Yeah, so as Audrey was saying, that the government have moved away from legislating everybody's daily life in respect to COVID, and we are moving into a guidance and a personal responsibility and choice. Obviously, that includes employers' responsibilities. The government website still states that the transmission of COVID-19 is a workplace hazard, and the Health and Safety Executive are still stating that employers should have a risk assessment in place for COVID-19. The HSE guidance was last updated 23rd of Feb and is due to be updated again next week. So some of what I'm about to say may change, but I don't see been significant change within that. So what are we expecting? What are we expecting employers to do, or what is the HSE and the government expecting employers to do? Well, again, it's down to that lovely word in health and safety called risk assessment, which we all love. Obviously, if we think about a biological agent, which COVID is, so it's a virus, therefore it's a biological agent, therefore it's covered by the Control of Substances Hazardous to Health regulations. So we would need to do a cost type assessment to assess how we prevent the transmission of COVID through our workplace. Now, this is not going to be back to the days of screens everywhere, everybody sat at 2 meters, because the risk of the outcome is lower due to the vaccination program. But we still need to be thinking about having some kind of controls in place and minimising the impact and how that goes. Just speaking, just personally, I mean, this morning, a live incident, one of my guys has just gone to go into a care home, tested positive, and he's now on his way home. So that just proves that it is out there still, and we do still need to manage it. So again, need to get a risk assessment in place, and the kind of things that we need to look at, we'll talk about a little bit more, some of them in a bit more detail, but realistically, it's ventilation. Ventilation is key to make sure we're getting fresh air through the building. Obviously, the virus spreads from droplets from people talking, breathing, etc. So if we can keep a good airflow going around a building, or people working outside where possible, then we can do that as much as possible. So as Kate catches up with the slides, because I'm on a different set of documents. Yeah, so ventilation is key. So again, so we're diluting the amount of potentially contaminated moisture droplets within the working atmosphere and keeping it away from people's breathing zones. How do we do that? Well, obviously we're coming into warmer weather, so keeping the windows open is more of an option than it was in the freezing winter. But even when it is cold, the HSE recommend keeping windows on a crack, so that you're still getting fresh air in, even though you're but not without letting too much hot air out. So we're in a situation there where even when it's cold, we probably want to ventilate. Hopefully we're not in the situation next winter when heating bills are going to be higher. So keep ventilation. One thing to avoid, and again, as we're coming into the warmer weather, one thing that the HSE are saying to avoid is desk fans. Avoid desk fans because they're normally set to blow air onto persons' faces. So if there is contaminated air in the atmosphere, contaminated moisture in the atmosphere, having a desk fan on is going to blow it straight into somebody's breathing zone and increase the risk of them catching it. Air conditioning is fine as long as they're extracting fresh air in from outside. So again, we're bringing fresh air in and taking stale air out. And they're also recommending ways that you can test for stale areas in your building or office where ventilation might not be working properly. Obviously, as we breathe out, at the same time as breathing out potentially contaminated droplets of moisture, we're also breathing out carbon dioxide. So you can use a carbon dioxide detector to indicate where there might be a non-ventilated or a poorly ventilated area within the building. And obviously then either move people out of that area or change the airflow, whatever you might need to do to improve ventilation in that area. The second one is cleaning and hygiene. So making sure that desks and work surfaces can still be cleaned easily, making sure that touch surfaces, handles on doors are still being cleaned, using antiviral wipes. If you're hot desking, making sure that the hot desks are cleaned in between use. Just the general good common sense standards of hygiene, making sure everything that we can do is in place. Obviously, we're in a situation in the world now where COVID's not going to go away. We're not going to be able to get rid of it. And as we say now, we're living with COVID. So the opportunity now is to stop people from transmitting that as much as possible. And a lot of these controls prevent other viruses, so flu, common cold, etc. So it's good business practice to keep illness and absence down anyway. Once we've done our risk assessments, then obviously we need to make sure that's clearly communicated to people. We need to make sure that everybody's got access to the safe systems of work or whatever we're going to put in place. Safe system of work makes it sound a little bit properly stringent than it needs to be, but how are we going to make sure where the hand stations are, when we expect people to sanitize their hands, when we expect people to clean the desks, make sure all that's communicated to people. We still have an extra duty to vulnerable workers under the Management of Health and Safety at Work regulations. So if we have got vulnerable workers, then we need to be having those kind of conversations with them. Are they still worried? Are they still at greater risk? Can they work from home? How can we mitigate the risk for those individuals? So again, have those conversations with vulnerable workers. If somebody does test positive, can they work from home? If they can carry on working from home, that's brilliant. But just to bear in mind, as we move on to talking about absence management with Audrey in a bit, that the Public Health England guidance is still anybody who's tested positive should stay away from people. So there is no legal requirement to self-isolate, but the guidance is still that anybody who has tested positive should minimise contact with others. And while we're on with minimising contact, one of the other risk assessment considerations is still team working in bubbles, minimising the amount of people that somebody is exposed to, so that if you do have somebody coming to work with COVID, it's limited exposure to a small number of people. And you're not exposing it to large numbers of people. And really, I mean, we're talking business continuity in reality. It's about how do you make sure that you're not going to lose a full key team of workers or an entire workforce. So I'll draw that to a conclusion, and I'm sure we'll probably get loads of questions to pick up in the Q&A later, and hand back over to Audrey for absence management.
Thanks very much, Phil. I think, as you can probably see from what Phil said, it's not really possible for us to offer specific guidance to everyone here or at all, because what any individual employer does depends very much on the risk assessments that you pull together, what your employees do for work. Obviously, working from home is not an option in quite a number of industries. There are questions about whether you have vulnerable customers, service users, for example, the care sector, whether you're public facing. Do you have employees who are particularly vulnerable or in contact with those who are? Do you have customers that may have their own sort of thoughts about what you do? So as Phil said, you need to kind of plan for ongoing absences. It's likely to stay a feature of the workplace, and just bear in mind that it is government guidance that employees should stay away from work. But the point we're going to move on to is that it's not any longer, of course, the law. So implementing rules over and above the guidance is obviously at your own discretion. The difficulty is that unless you have a contractual right to suspend workers if they have an infectious illness, which for most employers is a really unlikely provision that you'd have, you can't lawfully exclude people who are COVID positive. And certainly if you do, you'd have to pay them in full. I'll come on to that in a little bit. If you don't do this, we're talking about breach of contract, we're talking about potential claims for that, even claims for constructive unfair dismissal. You can certainly encourage people who test positive not to come to work. And of course, most people who test positive will be at least a little unwell for a few days. But we've now got a situation where employment support payments have been abolished, and also the special rules relating to SSP have changed. We're back to the old original SSP provisions. So there is a strong motive really for some people to, as it were, keep quiet and keep working because of the financial considerations of being off work when they're not actually ill. You might be wondering what would happen if you decide to just tell people to come in as long as they're well enough to work, even if they're COVID positive, irrespective of any tests they've had. Obviously, it's against government guidance, not against the law. What would happen if you did that? Firstly, of course, you have to consider the possible impact on your workforce of the infection spreading and the impact on others. You also have to consider, since it is against government advice, there could be an adverse effect really on your relations with your employees and also on your brand altogether. Only yesterday, the retailer Wilko was in a bit of a media storm because their policy of asking staff to come in even if they tested positive was leaked. People were talking about organising a boycott. They had a lot of unfavourable publicity and they were forced to withdraw the policy and do a complete 180 on that within the same day. So what can you do? Have a look at the policies you've already got in place for absent management, as well as your workforce and sort of cover planning arrangements and any special provision that you did make for COVID. When the pandemic was in sort of full swing, we did encourage our clients not to make special COVID employment policies. And really our view is that any absence policy should be broad enough to deal with any situation and any sort of fast moving changes. But have a look and see how everything does fit with the current situation. How do you normally manage with a small number of people off sick or a small proportion of your workforce? That obviously happens most winters for a lot of people. How will you manage if it's a lot more people who are off sick, and how long can you cope for? What sort of other resources might you be able to put in place? You should really sort of, if you can, maintain an environment where COVID effectively remains at the forefront of people's minds. One thing you could do once tests become payable is provide free testing in the workplace. You need to decide whether you'd hand out tests or ask people to test when they come in. You will still need to consider your messaging around positive tests and what you do if somebody turns up and then tests positive. If you have workers who can work from home, ask them to do this if they have COVID but they're still well enough to work. If you've been emphasising returning people to the office after COVID, etc., you might need to kind of shift your messaging a little bit around situations where they shouldn't come in. And obviously, I think this relates to a lot of the advice we've given over the last couple of months about hybrid working. On the next slide, I'm just going to put this all in a bit of financial context for you. So SSP is now back to being payable from the 4th day of absence. So because SSP rate's a lot lower than most people's earnings, there's a strong incentive for people to come into work if they possibly can. And the end to the self-isolation rules means that to be eligible for SSP, people have to have symptomatic COVID. Check your contractual sick pay policy if you have one. If there are references in that to discretionary pay, you might be able to use that as a tool to encourage the behaviour you want, but do be careful to sort of apply it fairly and consider people with other illnesses as well. Have a think about that, take some advice if you want to do that. Generally, case law around suspension deals with conduct issues. An employer needs to have a justified cause to suspend, even though that's with full pay. So the use of the provision, which is in the Employment Rights Act, of medical suspension has been untested so far in tribunals around COVID. As Phil said, it's a biological hazard. It falls under the COSH, Control of Substances Hazardous to Health regulations, but we've never really tried out the medical suspension rules in tribunal. Essentially, if you tell someone they can't work and there's work available and they're willing to do it, you need to have just and proper cause to suspend them and tell them to go home. If you're basing it on health and safety advice, if you're following government guidance, if you're following your own risk assessment and you've communicated all this properly to your employees, you're unlikely to have any problems. That's suspending them with full pay. And I know that's quite a difficult thing to consider, particularly if it's happening regularly. If you don't pay people when you suspend them, that is a breach of contract. And as I said before, could lead to a claim of constructive dismissal. So if you're going to send people home, make sure you have just cause, that you're referring back to your health and safety and your risk assessments, and do make sure that you pay them. If you're not going to do that, you need to think quite clearly about how you promote the government guidance to encourage people to stay off for themselves. I mean, incidentally, this is why if somebody at work tells you they're not feeling well, you should never just send them home, but obviously encourage people to make that decision for themselves. And that's the approach we probably recommend you take. Back to you, Kate, I think.
Brilliant. Thank you both very much. So we've got some great questions coming through. I think I'll start with this one, Audrey, because it's kind of relevant to what you just mentioned. But someone's put, is the SSP day for effective now, or is it coming in a certain date? They read somewhere they think it's the 17th of this month, but they just weren't sure.
Yes, in fact, I've lost track of the date of it. It's only the 15th today, isn't it? So yes, it's 17th of March.
Yeah, brilliant. Okay. And then, Phil, this is more, well, easier, I suppose. So having been COVID-free for most of the pandemic, we have high cases in the local area and now seeing cases in our workplace. How do we protect our pregnant employees in this instance?
I think, again, that's down to, there's going to be some very specifics there to a business, so I'll just be general in how I'm talking this through. But at the end of the day, if we're protecting all of our workers from COVID, we're naturally protecting our pregnant workers from COVID. So if we've got things in place like good cleaning, good hand washing, people are sanitising, people are not coming into work if they're coughing and spluttering all over the place, then that should do it. I mean, it's down to common sense, but we know in health and safety there's no such thing as common sense. So it's just educating the work. I think the days of people struggling to work with a cold and coughing and spluttering everywhere have gone. I think the last 2 years has probably taught people that you don't come into work when you're ill. Obviously, it's difficult when people are not getting paid SSP, as Audrey just alluded to try and stop those people coming into work. But I think if we just focus on that, and it's not just COVID, as we mentioned earlier, there's loads of other coronaviruses out there that spread in a similar way, the common cold, influenza, and let's not forget the seasonal flu kills people every year as well. So what we're doing for COVID is good for everybody. It's good to prevent all diseases. But yeah, coming back to the point on pregnant workers, let's focus on protecting everybody, and then the pregnant workers automatically fall under that umbrella.
Brilliant, thanks for that, Phil. So just to clarify what Audrey was saying there, the changes will come in on the 17th. I've noticed on one of the slides, there's a slight typo. I put the 24th. I will hold my hands up. That was my apologies. So just to clarify from a couple of the questions coming in, that was to say will change from the 17th of March. One of the things, another question that's coming with regards to sick pay, what are the recommendations for a factory environment where employees do not get sick pay and cannot work from home? what would be the best advice there?
Well, obviously, if people have symptomatic COVID, they would be entitled normally to statutory sick pay under the original provisions from the 4th day. Clearly, you just need, as I said, to encourage an environment where people are not struggling into work with coughs and colds and so on, and they'd just be eligible for SSP in the normal way.
Yeah, so I think that just comes down to what I was saying earlier,
Yeah.
doesn't it? About it's a change in people's behaviours and attitudes. The living with COVID basically means that we're accepting that COVID is just the same now as a cold or a seasonal flu.
Yeah.
As I mentioned, seasonal flu kills people, and it's very rare, but we do know that the common cold can cause people to have life-delaying injuries and illnesses. So all coronaviruses are potentially nasty. Now we're getting on top of this one and we are living with it, but hopefully the behaviours are changing so that people don't come to work with a cough and a cold and a sneeze. Yeah. And regardless of whether it's a COVID, a common cold or a seasonal flu, and we've started to change those behaviours. Now, whether the government catches up with that in SSP, that's not for us to comment on, but we're in a situation here now where it's good business to encourage people to stay at home if they're not well.
And also, I think that the other thing you could look at is whether it might be worth your while giving people tests to take if you're particularly concerned, because obviously the current variety of COVID is extremely transmissible. You could end up with a lot of people off. So perhaps the provision in the workplace of tests might be one way that you could help to manage that.
Brilliant, thank you. And someone's asked about the SSP changes. Would that be the same in Scotland? Do you happen to know?
I don't know, but I'm happy to send that person an answer.
That's fine.
Afterwards.
We will check that and we will come back to you. Jasmine, thank you for that question. Someone's asked, and I suppose this goes back a little bit to what you were saying, Phil, about individual companies and workplaces. That can we ask someone not to come into work if they've been in close contact with someone who's had COVID?
The easy answer is no, because obviously there are no legal requirements for them to self-isolate. I think that goes back to potentially what Audrey was saying about having tests. Especially if you're in an environment who's in the care environment, a GP or some, where you're doing close personal services, it might well be there that you're wanting to get somebody tested, say they have been in close contact, to make sure that they're not carrying, just that you're not passing it on to your customers, your service users, etc. But the overarching, like I said, the quick answer to that was no, because there's no requirement to self-isolate as a contact anymore. I think actually, before this, we were having a conversation before the session started, and it's probably just worth one of the things that we said was it's probably more confusing now than it has been in the previous 2 years, because we're just left to everybody's own individual interpretations and guidance and responsibilities. Whereas before we've had clear rules and guidelines to go by. So I think the next 2 to 3 months as we work out what it looks like moving forward, it's going to be quite a lot of personal decisions going backwards and forwards between employers and employees, trying to work out exactly what is the right thing for that organisation moving forward. And the last thing we want to see is those numbers going up and the pandemic starting to become an increase in cases and an increase in serious illness. But that's fingers crossed, touching wood and everything like that. We're at the stage now where, as long as we do the catch it, bin it, kill it, wash your hands, and all the good public health England guidance that was around for flus and colds 2 or 3 years ago. I mean, we sat in this room, and 2 years ago we did a webinar about just before everybody went into lockdown, and we were talking on those webinars about catch it, bin it, kill it, making sure that you sneeze into a hanky and it goes in the bin, making sure you wash your hands. All of what we're saying 2 years ago is now relevant again as we're coming out of the pandemic. Probably rattled on a bit there, but if you have
no, it's really helpful for that, and I totally agree. I think we are in this. I think the whole, title of the webinar says it all, doesn't it? Living with COVID plans is that it is a new thing, and there's a lot of grey areas still. And it's things like a question here says, can we still encourage our employees to wear masks? It's not mandatory anymore, but it's something that we'd like to continue with. And I suppose from your point, it's to say, isn't it?
Yeah, I mean, again, going back to a conversation we had before we started the session, I think I personally am not a fan of masks. I hate wearing them. It comes back to my days of being an asbestos surveyor and having to wear them all the time. They just got on my nerves. But if I was in London on the tube, I would probably put a face covering on. And I think it's around educating, and it's around having a culture where if somebody wants to wear a face covering, then they're not being, I don't want to say victimised, probably too strong a word, but they're not being called out by the rest of the workforce. That people can feel safe that they can wear a face covering as they're walking around or in a lift. And if the hand gelling every 5 minutes, nobody's going to be pointing fingers. It's about having that kind of culture that good hygiene is good for business.
And someone's asked with regards to the risk assessment piece that you touched on earlier, Phil. So should we do a risk assessment for all staff for a one-off event that we're having coming up, just to make sure that we're all compliant and safe? I think
I'd just do a very simple risk assessment. Let's not overcomplicate this. At the end of the day, if it's an event, let's just make sure that there's ventilation. Let's make sure that everybody's hand washing, and make sure that people are reminded not to turn up with symptoms. If you went to the nth degree of what we were doing 2 years ago, you're basically putting lockdown controls in place. So let's just keep to some basic common sense. And again, put on everybody, it's the personal responsibility of those attending to make sure that they're not coming with symptoms.
Brilliant, thanks Phil, that's really helpful. So I think I've got one for you now, Audrey. So if an employee was told to stay home and not go into work when tested positive, even if they are fit for work but cannot work from home, should they be paid their full pay rather than SSP or OSP?
In very brief terms, yes. If somebody is able to work and you're telling them not to come in, this goes back to what I was saying before about that's potentially a breach of contract, or they could even claim constructive dismissal. I would recommend that you would suspend them potentially under the medical suspension rules and pay them in full. If that's your decision, that you have to tell them not to come in. Ideally, we'd want people not to get into a situation where you'd have to be enforcing rules of do not come in, but the situation is you would need to pay them in full. If you don't want to talk to them particularly about suspension and you do have occupational contractual sick pay, it might be worth looking at any discretionary clauses you've got there to pay them.
Fantastic, thank you. Phil, we have another question about face coverings. We're a public-facing service company, and can we ask members of the public to wear face coverings when attending our offices?
I think the one on there is, yes, you can always ask. It's whether you can insist that's a different question. And I don't think you can insist under the current guidelines, but possibly if your staff are concerned, there are other things that you can do, like physical barriers, screens, keep the screens up potentially. So just have a think about what else you can do that doesn't require the public, because the hardest people to control in any work environment are the public. So if that is still a concern, just maybe keep the perspex screens in place, maybe keep some distancing, maybe not as obvious as barriers, but maybe just desks that are like 2 meters, that are a bit wider than normal, so that you're pushing people away. Certain engineering controls that don't require a member of the public to wear a mask, because like I said, members of the public are the hardest people to control in any environment, as you're probably aware.
Certainly are. So another question I think for you, Audrey, around the SSP. So it's asking, could companies match SS payments for day 1 through 3 prior to SSP is paid, to encourage those with COVID not to come in for the first 3 days?
The answer to that is yes. I mean, it wouldn't be SSP and it wouldn't fall under the about to end provisions for reclaiming SSP. But if you want to make a discretionary payment to employees to not come in on the first 3 days, yes, you could do that. You'd need to communicate quite clearly. You'd have to be aware that you might end up getting pushback from people with other kinds of illnesses. So I'd take some advice on the specific situation, I think, but legally there's nothing to stop you giving your employees more money.
Thank you. And then someone else asked, if a member of staff is positive but well or asymptomatic, can they still attend work? Asymptomatic, sorry, can they still attend work?
Well, I think, Phil, I expect you to agree with me here. It's not a great idea, is it? Because obviously it's about passing it on to other people, including other workers, which could have an impact on your business. So they might be asymptomatic, but if they spread it around, you could end up with a lot of people off sick. So the government guidance is if you test positive, you should not attend work. And I think that would have to be our main position on this.
Yeah, I mean, obviously we're still coming out of the end of the pandemic and there's still potential for things to relax even further. But the way that the government guidance is at the moment is strongly encouraging people who've got COVID to limit their contact with other people. So yeah, it's obviously the test and trace has finished. So as an employer, you're probably not going to know in that situation whether the person's tested positive or not, because they won't tell you. But yeah, so with that again, which is why we need to be careful in the workplace, that we're cleaning, that we're ventilating, and that we've got hand sanitizer to minimise the risk as much as possible. I mean, we talked about the risk assessments earlier, and we could end up in a month's time, I might be doing another webinar or a blog that says you don't need to do risk assessments for COVID anymore because the guidance might change again. So it's definitely a watch this space. But yeah, in that question, then no, I think you need to encourage people who've tested positive to stay out of the workplace as much as possible.
And then one final one, someone says, can we force our employees to wear face masks?
Technically, yes, but I think it would be difficult. So the technically yes is if your risk assessment says that face masks are required to protect against a workplace hazard, then the employee is legally bound to follow your risk assessment. I think given guidance, unless you're in a profession that's dealing with COVID positive people, knowingly dealing with COVID positive people, it would be difficult to justify everybody wearing masks as a suitable control at this current point in time.
Brilliant, thanks Phil. So we've got quite a few cool questions coming in around Bradford factor and policies and that type of thing, and obviously as we've identified, we are still learning and changing into this, so we will endeavour to answer those questions offline and we'll come back to you guys. I think I'd like to thank Phil and Audrey for your time this morning. As I say, there's more likely to be further webinars on this subject as we kind of live with this new normal, but I'd like to again thank Audrey and Phil for their time today. I'd like to thank everyone on the line who stayed. And again, we will answer all your questions with regards, if we haven't got to them so far, we will definitely be coming back to you in the next day or so. I think I'd just like to wrap things up and just say, if there are any other things from a resource point of view that you'd like to look at, you can see on the screen there, Morpay's Knowledge Centre. It has a various different raft of information on there and legislative guides to help with employment law, health and safety and HR services. I hope you found it helpful. Again, thanks to both of our hosts. And I'll close the webinar there, but thank you all again.